Oh, it's huge. And I recently wrote a book. My listeners know this, Health for Us All, The Transformation of U.S. Healthcare. This is what I talk about, is that the doctor and the patient, we're at the bottom of the healthcare equation. All the dollars are going to all this, what you talk about, administration, bureaucracy, authorizations, denials, regulations, and it's an abomination what has
It
happened.
really is, and the system rewards uncaring, poor doctors that don't care and practice poor medicine. And so, what the system is, it will reward a doctor who will see a ton of patients and see a high volume, see them for 5 minutes, and just say, "See you later." But a doctor who cares and wants to spend time with their patient just goes crazy, because you can't spend enough time. There's no reimbursement for it. And finally, doctors get fed up, and they can't really fight the system. So what they do is they finally get, I'm going to do concierge medicine or something like that. And people, oh my gosh, that's terrible. But that's what's happening, because doctors are finally being pushed to the brink and say, or they're going into another profession. And all that doctor-patient relationship is taken out of it. Doctors are not doctors anymore; they're now providers. And it's what the doctors have allowed insurance companies to really rule medicine. And what they're doing now, insurance companies are now going to grade doctors on how good a medicine that they practice. Well, what does that mean? It means how much money they make for the insurance company.
Exactly. And I just heard of a colleague who is practicing, he charges his patients $79 a month, and he provides all their care. It doesn't matter if he had to stay up all night with this patient, he will take care of that patient. And he's coming under some criticism from his colleagues, but the patients really
Right.
like it.
Right. And you'll find a lot of the criticism is out of jealousy. Why should you be able to not take insurance and I have to take insurance? Because the doctors are miserable. And again, it's just they know they're providing terrible care, but they're made to feel that they're somehow greedy if they go outside the system. But it's just such a bad system that there has to be something done. And again, it's the good doctors are suffering and want to practice good medicine
That's right.
and care about their patients, but the ones that don't, they're fine.
Well, what do you recommend for our listeners? This is our topic here, health reform. And what are some things that we can do?
Well, I mean, there's a very difficult situation, and you say, well, write your congressman, and does that really make a difference? I mean, it's so you look at the drug companies have a 5 lobbyists for every congressman.
Right.
5 lobbyists for every congressman.
Mm-hmm.
And I mean, they're just every time they turn the corner, there's another drug company, basically saying, oh, here's the benefits of using the drugs, or insurance companies, huge amounts of money being put into these influencing Congress. So it is so difficult, and common sense doesn't matter. It's who gets the congressman's ears is unfortunately the biggest problem.
One thing we've talked about a little bit is the Health Freedom Protection Act, which Ron Paul introduced several years ago, and I've heard he's going to be, it fell on deaf ears for a while, but what it really means is we, as doctors and patients, we would have full access to natural alternatives, as well as if we chose conventional medicines, fine. If we wanted natural, that's fine too. And what do you think about that?
Well, I think all those are very important, and they're always under attack. You get the FDA, wanting to limit everything and control everything, and really, the best medicine is really to have the patients decide what is best for them. It's kind of like government control. Do you want the government telling you what's good for you, or do you want yourself? And that's really is historically been the best medicine, is let the patient decide. And you look at even how to show you how much influence. You look at the hormone estriol. So it's another natural estrogen that's naturally produced by a woman, and it actually prevents breast cancer. So it's available as a compounded prescription, not available commercially in this country, although in other countries it is. And studies are clear that it's much safer than standard estrogen replacement. And 30 years of studies have shown, the FDA has never had an adverse event reported with it. But what happens is all of a sudden they start saying you can't compound anymore because Wyeth, which has, after the Women's Health Initiative study came out showing that their version, Prempro, with horse estrogen and synthetic progestin, increased the risk of breast cancer, which of course we knew, and increased the risk for heart disease. Instead of coming out with a better product, because they start losing market share, they go after compounding pharmacies saying, hey, they shouldn't be able to compound estriol. So it just shows you the influence and lack of common sense in what happens in medicine.
Well, it's a disaster, and with all this, the health system, the illness system's going broke. I mean, if anybody doesn't know, we spend $2.3 trillion every year on these outrageous illness costs. They're saying in not too long it's going to be $4 trillion a year. We talk about there's going to be no money to bail this system out.
It is, and and most of the money is spent in the last year of life. You know, we go through extraordinary measures in the ICU, and
That's
almost nothing put to preventative medicine.
That's right.
And it's the big problem. You know, it's like, you know, people are falling off a cliff, and then basically you just keep spending more money treating the people after they fall off the cliff instead of putting up a fence. You know.
Exactly.
And you're never going to have enough money. So it's just the focus is in the wrong place. But again, because the problem is when you look at insurance companies, they say they'll pay for preventive medicine, but they don't, because what they found is that, let's say they're going to prevent your heart attack. They know that in 10 years you're probably not going to be with that same insurance company, so they figure, why should they pay to save money for another company? So they only are going to pay for something they have to pay for, and those are things like, okay, person has a heart attack, well, we're going to have to pay for this person with a heart attack, we need to treat it. But they'd rather do that than prevent it 10 years earlier.
That's right. But what you said was critical earlier. What do the patients want? And when I talk to my patients, they very much want the knowledge to prevent it in the first place.
Right.
Which is why our health system is upside down. You know, I have a not-for-profit, and that's my motto. It's patients first. The system's upside down. We need to turn it right side up. Let's put patients first. Give them informed consent. And I applaud you, doctor. You know, we say, well, gee, we can't do anything, but you've done a lot. I was reading your article earlier today, and the title is Bioidentical Hormone Debate. Are bioidentical hormones safer or more efficacious? This just came out in Postgraduate Medicine, January 2009. That took a lot for you to summarize this. Could you please share the summary with our listeners?
Yes, and so there's a lot of debate over bioidentical hormones and what bioidentical hormones are, or hormones that are exact copies of what a woman naturally produces. And you'll hear the people like, you know, it was on Suzanne Summers and Oprah saying, hey, they're better. Then you get so-called mainstream doctors saying there's no studies. And so went and looked and said, are there studies? And reviewed all the literature, and there are hundreds and hundreds of studies. And interestingly, they all show that bioidentical hormones are safer. They reduce the risk of breast cancer. They have increased efficacy in preventing heart disease compared to standard hormone preparations. And you say, well, how can this be? And when you look at, you know, these so-called experts, the overwhelming majority are basically on the drug company payrolls. You look at societies like the Endocrine Society, 90% of their money comes from drug companies. So they really have a vested interest in trying to promote the drug companies. And it's really a shame that they're willing to put the profits of their organization and the drug companies of their financial backers ahead of the health of women in this country.
Well, and it's true.
Really a shame.
Doctor, it is. I know 25 years ago, my mom, who's 84 now, but she was diagnosed with breast cancer, but she had been on the synthetic hormones. Now, this is years ago.